This is an unbelievable resource for a very challenging and demanding and timely topic that you've just got to get involved with. And nobody better that I've ever met in my 38 years in the business.
Today's podcast is a fantastic interview with a really, really great guy named Mark Brownstein. And if you don't know Mark, in simplest terms, he is the Ed Slott of Medicare. You all know who Ed Slott is. If you don't know who Mark Brownstein is, then that's the simplest way to describe it. He is the world's expert on Medicare, and he will help you and help your clients, and he's just an unbelievable resource. And I'm really happy to have him on today's interview. So take a listen. I think you're really going to enjoy this. Mark Brownstein. I'm Frank Maselli, and you're listening to the Advisor Academy.
Welcome back, everybody. It's good to be with you. We have another very exciting call today, something I think you're going to really enjoy, and somebody I have come to enjoy quite a bit for a variety of reasons, not the least of which is that he's helped me tremendously on a personal level as well as a professional level since I just turned 65. But we've got a fantastic guest, Mr. Mark Brownstein from Emerald Medicare. Mark, welcome aboard.
Thank you, Frank, so much for allowing me the opportunity to share what I'm passionate about with the people who are connected to you.
Well, thank you, and you are passionate. I have to say, I've spoken to many advisors over the course of my career, and I've met a handful of folks who I thought were really lightning rods and people who really had something going on, and it's been exciting to get to know them. And then I met you, and I was saying, oh my God, this is a subject that very few advisors get into, but everyone kind of needs to know more about it. And you are the most passionate person I have ever met about this subject. And as I mentioned earlier, I am calling you the Ed Slott of Medicare. And I hope you're okay with that title. I mean, I know you know Ed, and we all kind of know Ed as the IRA guru in the industry. You are the Medicare guru.
I am honored and humbled to be in that genre and that group of connections. And I am passionate. It is so important. 10,000 people are turning 65 every day in America. And that marketplace of Medicare is underserved.
It really is. And even professionals, and we met a few years ago, and I can't even remember where, but we've known each other for a while. And then we were having a conversation, I guess it was several months ago. And I happened to mention that I was turning 65, which I just did, like last week. And you said, well, have you done anything about this? And I'm like, no, not really. And you said, well, you really need to do something about this because there's a window, right? I mean, there's what is it, 3 months before and then 3 months after. Is that the basic window?
The window exists in the media to some extent because it's for those people who are turning 65 who are unemployed, self-employed, or working for a company of less than 20 employees. It absolutely applies. For those folks who are covered under their own coverage or through their spouse's coverage, who are working for a company larger than 20 employees, they can delay this decision. But just that question alone, Frank, is questions that come up, and I encourage people to really understand it so that they make no mistakes. In many cases, financial planners do not want their clients to make mistakes.
Right.
So yes, that window is truly 3 months before, because why wait till after? And then there may be a gap of coverage. So it's really 3 months before, but it's really about finding the right resource to understand the timing of Medicare.
Right. It is a time-sensitive issue for a lot of folks, and if I'm understanding it correctly, if people miss certain deadlines, there's significant penalties and problems that they face for forever at that point. I mean, it's like an irretrievable mistake, irrecoverable. So is that, your understanding as well?
Well, certainly there are very few people who wind up making the big mistake of truly delaying only Part B and actually Part D. But the Part B premium is applicable to everybody. The Part B penalty is really, again, only for those people who are unemployed, self-employed, or working for a company of less than 20 employees who have not applied for Part B. It's also for those who are on COBRA past the age of 65. COBRA is not considered credible coverage and has caused some challenges. In every webinar, seminar that I do, I encourage people to reach out 3 months before they turn 65, 3 months before they retire, just to get an understanding so that they don't make these critical mistakes. But yes, the penalty could be as much as 10% a year for every year that they delay for life.
Wow. Wow. My purpose in having you on the call today, honestly, was much less to get into the nuances of Medicare and much more to awaken the advisor population to the need to get involved with this process with their clients and maybe even prospects, maybe even talk about this, to get advisors to kind of say, oh my God, I really do need to understand more. And you are a resource for advisors. You are somebody that works with advisors. Talk a little bit about that, how you like to work with advisors, how you help, the training you do, the calls that you do, how you can be valuable to advisors nationwide, because that's kind of how I met you.
Well, thank you, Frank, for that important question. And I have been in front of literally thousands of financial planners in both webinars, seminars, and lunch and learns. And the reason I'm brought on to speak and to educate these financial planners is because this is a critical component of financial planning. Financial planners are looking towards the future. They're looking out towards what are the potential expenses, pitfalls, out-of-pocket expenses that could incur as they turn 65, as they retire. I have been at clients' offices. I have been on Zoom calls. I've been on conference calls. I've been able to develop the trust with these financial advisors so that they can understand that I am, one, looking out after their client's best interest. Two, I am doing whatever it takes to be independent of all carriers. I am helping them make the choice of, let's call it 15 different carriers in the state or the county in which they live. And I am making sure that they are getting the best advice, whether I help them today or 3 years from now. My goal is to gain the trust of the financial planner and thereby gain the trust of the client. These components of Medicare are confusing. People get mail and phone calls consistently and obsessively. And financial planners want to know that there's a resource that they can trust, and I have become that resource. I was also, Frank, the president of my local financial planning association for 3 years and chairman for 3 years.
The FPA,
through FPA. So I've been involved with planners. I understand them. I respect the work that they do. I'm not competing with them. I'm really there as an additional resource for them in this important area of their healthcare expense as it looms large in their future.
What would you say, I mean, in your experience, the average financial planner, would you say that they are well-versed, not well-versed, completely ignorant, or just, relatively clueless about the whole Medicare thing?
With due respect to the fact that they have so many areas of expertise on their plate, this is not one in which they have focused in on. And so they know that healthcare expense, whether it be long-term care expense or just general healthcare and Medicare expense, is something that could be quite significant in the future. I would say that they do not know much, but they tend to learn more as they get closer to the age of 65, because for their own individual needs, they realize that, and in many cases, working maybe for a smaller independent firm, they need to take some action for themselves. Then, yes, it becomes much more apparent to them that the clients that they have should also understand this as well. But I would say that they've got a lot on their plate, and that they appreciate the opportunity to work with a trusted resource who really specializes in this area.
That's exactly how I came to this. And my realization was, oh, gosh, I better do something for myself. And then after we talked, I'm thinking, God, most of my advisors, the advisors who I talk to, they don't know this stuff either. You as a resource for advisors to be able to give them, to arm them with something, valuable and interesting to say, or at least questions to ask. I mean, I think that's just an essential part of being a financial advisor. Obviously, you agree. So
I do, and you're right, Frank. It's a milestone decision. For most people's life in work, they have had a few choices from their company that they have had to make around their healthcare choices for themselves and their family. This is the first time in most people's lives, unless they're solo entrepreneurs, small companies, where they have had to make their own decision on their healthcare needs, which includes the medical side and the prescription drug side. They have not been in this position before. It's overwhelming because they have not had to review plans, understand the issues, because other people in the company have done it for them.
Yeah.
And so this is really a step outside of what they're comfortable with in many cases for the clients. And my experience with financial planners is truly that they know that this healthcare issue is something that people want to know more about. But because they don't necessarily know much about it, they're a little hesitant to bring it up. It's not
Right.
like another subject, let's call it Social Security for the moment, where they may not know all of the rules around it. So not bringing it up is a safer model. The more people I'm in touch with, the more planners I reach out to, whether I get one call a year or 10 calls a year. I don't care if the person's 60 or 80. I will always take the call. My services are free because at the end of the day, the insurance company pays me. And when people know that my services are free, they're more free in their own mind to at least ask the questions so that there are no mistakes made in the future.
Yeah, very, very important stuff. And you're right. So many advisors I talk to are doing seminars and workshops, and one of the most popular topics in workshop world these days, and has been for a while, is Social Security. And they seem to know a lot about Social Security, but in that workshop, in most of those workshops, the Medicare discussion is one slide.
Right.
It's like, look at your Medicare options, and then they race past that because they're not skilled. They're just not, schooled in how to handle stuff. They're great with IRA rollovers and Roth conversions and, cash value life insurance and all that stuff. But when it comes to Medicare, there's this big void, there's this big blank space in the conversation with most advisors. And gosh, it's just, isn't it like the single biggest concern on the mind of retirees is healthcare? And it certainly is going to be one of the biggest costs they probably face in their lives post-retirement. So it's kind of a scary thing.
Well, it is. And there's two parts of it. There's the medical care and there's chronic care, right? And so chronic care is long-term care insurance, and hopefully by the time they're 65, they've already taken care of that. But the medical coverage, that is something that has, in some cases, a limited out-of-pocket exposure. And in some cases, the prescription drug side doesn't have unlimited out-of-pocket exposure. And so, again, when it comes to calculating the expected expenses, the softwares that are out there that do all this financial planning work doesn't really take into account very much the Part B premium, the Med Supplement or the Med Advantage premium, or the prescription drug costs for a particular individual that could be fairly catastrophic.
Yeah.
I've often talked to planners about two important things, Frank. One is to try and find a way within the software that they use for financial planning to include some aspects of Medicare and or prescription drug costs in the calculation for themselves or their spouses.
That's very, very important.
Is this income adjustment, Frank? This income adjustment is based on income from 2 years prior. And income from 2 years prior could be high because they were working years. It could be because they got some kind of a bonus or some kind of an exit package.
Mm-hmm.
But the Part B and Part D premium can go up from approximately $150 a month to almost $500 a month per person per month. And unless the planner is sort of looking at ways in which they can sort of shift the income stream over a longer period, maybe through Roth conversions and other things that I talk about in some of the financial planning webinars I do and seminars, is that that Part B income adjustment could continue forever, or it could be adjusted through something called the life-changing event form. I have helped hundreds of people, and clearly through planners, I see clients of theirs who have higher incomes. And this life-changing event form looks at it today. So if the income today is lower than it was 2 years ago, you can get that $500 Part B premium reduced to the $150 because you've appealed this income adjustment that was applied to you because of your income. This is critical. This is incredibly valuable to those planners who understand this form and the need to sort of extend the income in a way that doesn't really impact. There's a difference between 150 and potentially up to 500 per month per person. That's a huge difference in expense and cash flow for an individual.
Oh my God. Yeah. Wow. The knowledge you have in this area, I can't imagine there are too many people in our profession that know more about this than you do. It's a highly specialized area. It's an area of critical need. It's an area where most advisors just don't have the time, inclination, expertise, training to understand this. So in an ideal world, how does an advisor work with you? You said earlier your services are free. I'm guessing that's for clients. That's for retail clients. Is that correct?
All financial planners, CPAs, consumers, healthcare providers that reach out to me, my services are always no cost. I get paid by the insurance company when I help them someday with a supplemental plan of any sort. Okay. I often help people in the early stages of getting just Part A and Part B, because that's where the confusion starts. That's where the questions are. That's where the frequently asked questions come from. And that's where I gain their trust.
I got you.
If I can help them get their Medicare card, knowing that they're doing it in a timely way, then getting them the supplemental plan of some sort that fits their health and budget is sort of the easy part. The real challenge is knowing when to do it, what the timing of it is, and knowing that you're not going to have any gap in coverage. So no, Frank, my services are absolutely free to planners and consumers, and I'm proud to say that. It's a nice thing to be able to say, and certainly some people I'm on the phone with a few times, and I've been on the phone with people a dozen times just to make sure that they understand. I have a team of people. We all answer questions. We're all able to help people. We're 12 months a year. We're not a seasonal business or open enrollment, which is October 15th through December 7th. We're helping people all year long because people turn 65 and people retire all year long. And I say that often because the numbers of people who are working past 65, you and I are both in that group, Frank, is that the people who are past 65 are very high. And so they just need to know when they retire what to do then.
Yeah. Yeah, very, very important. Well, that's phenomenal. I mean, that's just an incredible service, Mark. To be able to say to planners, reach out to me anytime, it's free. That's exciting. So now you've done FPA events, which is great. Are you marketing yourself to any other organizations in the biz?
So yes, again, being a former president of a chapter, I certainly know a huge number of folks. Certainly a lot of broker-dealers have reached out to me. I've been to many offices, lunch and learns. So whether it be Ameriprise or Cetera or even UBS, Merrill Lynch, I can go down the list, LPL. People find out about me through various sources and through sponsorships that I do at various chapters, as well as some other workshops that I'm involved in. So I get calls from planners. I get questions from planners in an email, and they just appreciate the quick answer. I try to be as responsive as I can and as timely as I can. But yes, the Financial Planning Association has been my sort of launching point. But through the years that I've been in this business, I certainly have gained a solid reputation with other planners and other offices to be able to educate their team of people as needed, as requested, and as live as I can get there, so that I can actually have the opportunity to get to know them and offer my services to them.
Not only are you knowledgeable, but you're also tremendously fun to watch and listen to. You make this stuff come alive. And I mean, if somebody said to me, I want you to go to a Medicare workshop for a financial advisor, I'm like, no, I don't think I'm going to be, I'll skip that breakout session, but don't skip this. I mean, you bring passion, you bring fire, you bring excitement to a topic that is absolutely life and death critical, literally, for clients, certainly, and extremely value added for advisors. So you're a lot of fun to listen to and very
well. Thanks, Frank. To me, I try my best to keep this simple, right? And my comment is I can explain this in 3 minutes, or 2 hours. But when it comes to keeping it simple, really, there's 4 choices. There's you stay on the employer group plan, which is fine. People love their employer group plan. You can go into original Medicare, only A and B. You can go to these HMO, PPO, Med Advantage plans. And those are the most highly marketed plans in America. Yeah, they're 0 premium mostly. And they have prescription drug plans included. And yes, they have dental and some vision, but they're a network. And then there's Medigap plans, more expensive, more flexibility, more doctors around the country. That's the 4 choices.
Mm-hmm.
And that's how simple I make it, but of course, a little bit more depth. But, not getting into the details, it's really 4 choices that people have as they get to 65 or are still working. There are companies that are paying, let's call it $800 to $1,200 a month for a premium for an individual. If they go into Medicare, they can save half of that and pay for the premium and the Part B for an employee. I see it all the time. And so the cost of group coverage is expensive. Medicare, quite honestly, is for some people an absolute bargain and better coverage. So there are many people who truly evaluate their employer group plan and Medicare and go, wait a second, what am I missing here? Is this true? And the answer is yes, it is true, which is why, again, the press and the media does not explain Medicare in a way that I think Americans understand. But is Medicare, in fact, a great program? Yes. Does it cost the government a tremendous amount of money? Yes, it does. My thought, Frank, is that someday maybe it'll go from 65 to 62. And the only reason why I say 62 and not 60 is because, as you know, Social Security starts at 62 in most cases, and for many people. And people get confused. It's the same department that they have to call, and they go, am I collecting Social Security or do I start Medicare? No, I'm not 65. So the confusion is, and the opportunity is to somehow align it, maybe someday. But again, keeping it simple, letting people understand that they shouldn't panic. I've seen some real panicked people, Frank, on this issue, and very smart people to boot, who just want to make sure they understand it. Again, I get a tremendous amount of satisfaction from this book, Frank. I've done a lot of things in my career, and this one has been the most satisfaction I've ever received, because everyone needs to understand it and or talk about it, and they just want to know that someone can explain it simply.
Yeah. No, it's fun. It really is. It's exciting and it's extremely valuable what you do for advisors and clients. So talk to me about other resources. Do you have other things that are available for advisors to look at, maybe things on your website, newsletter, blogging, anything like that?
So, I have some handouts. Again, this keep it simple 4 choices, the different enrollment periods that exist, this income adjustment piece that I mentioned, and also a Part D prescription drug plan sort of summary that goes from the deductible phase all the way 4 phases later into catastrophic. So I have 4 handouts. that I typically offer to people because that is really, I think, the simplest way to sort of look at Medicare. But in general, I would say that I have written, many articles. I have my seminars or webinars on my website, emeraldmedicare.com. I am, not prolific in blogging, so I'm sort of not as engaged in that model. I really try to stay active locally or regionally in various community events and just continue to brand myself in a way that people understand that there's a resource out there.
There's no one I know in this business that knows more about this than you do and is as passionate and eager to spread the word about this subject as you are. And it's something that every advisor needs to touch. They need to understand it. They don't need to become experts, but you're the expert, and you can be on tap for folks. So that's wonderful. Your website is Emerald Medicare, Emerald, emeraldmedicare.com. Give me a number where people can reach you, Mark.
Sure, 845-358-1220.
845-358-1220. Excellent. So advisors can reach out. Mark, you're on the East Coast, so that makes life a lot easier. And advisors listening to this, listen, you really do need to get involved with this. You do need to understand more about this. It's very, very important. I mean, I've been in this business for 38 years. I know nothing about Medicare, and I didn't even think to know about it until it hit me. You guided me, you helped me, and it really made a difference. And from that moment on, I said, more people need to understand this. More advisors need to understand this. So I'm hoping all my people reach out. Go ahead, I'm sorry.
But I just want to acknowledge a few things here, just as sort of maybe some takeaways, if I may.
Please, yeah.
Is I think it's important for financial advisors to acknowledge the importance and the integration of healthcare cost planning with financial planning. That's one thing. The other thing is this proactive IRMA, this income adjustment. Proactive, not reactive.
Okay.
It's about, as I mentioned earlier, it's about sort of looking at their future income when they retire and go on Part B, because the Part B income can change. Part B premium can go from $150 to $500 a month. So that's important. The timing of Part A and Part B. It's important for as a takeaway to just realize there is timing issues. Group coverage compared to Medicare, worth looking at always. Evaluating your group coverage, but it's really about looking at your doctors and your medications. So you have to look at both of those in order to make an intelligent decision. The other thing I would say is differentiate yourself, planners. Be an advocate for your client in this area, helping them to understand this, knowing that you just have a resource, a dependable resource that's independent, experienced, and trusted, I think goes a long way towards you differentiating yourself and providing a alignment with a third-party specialist. And of course, it's a complimentary service, so there's no cost to anyone at any time. So those are my takeaways that I think are really important for financial planners to understand.
Just to go back for a second, do you, you'll speak to an advisor with their client, a planner with their client, but is it generally appropriate to talk to the planner first, get a feel for the client, and then do the joint conversation, or how do you normally like to do that?
Frank, when people have developed the trust with me and have been on the phone with me multiple times, they don't always feel the need.
Right.
But there are some clients or planners who want that initial handoff to be made in that manner.
I got you.
So if that's the way it's set up, I will always accommodate. And at some point, it does seem, because the devil's in the details, is when I start to talk about their doctors and their medications, the planner doesn't need to be on the phone for all of that. That handoff has taken place, the trust has been established, and I get the work done, and I will often thank them in some way to acknowledge that the client has been taken care of fully.
If I'm a planner and I want to do a webinar for just my clients and prospects, is that something I can talk to you about? I mean, will you do that smaller group?
What a wonderful question, Frank. I have 3 plans for the fall already for financial planning offices who are bringing in their clients.
Oh.
So absolutely, I'm happy to provide that extra service. I don't care if it's 2 or 22 people. I'll bring in the food. I will truly be available to a group of people who either are planners themselves or bringing in their clients. I have done joint presentations with planners. They've done the Social Security portion, and I've done the Medicare portion.
Mm-hmm.
And in some cases, I've just been the only one doing the Medicare portion, and they've introduced me, and then they are able to sort of talk about their services, or they already know their clients, and it's really, in some cases, connected to a client appreciation. So yes, that's a great question. Thank you for asking. I'm happy to do so for any planner that is interested in bringing in their clients or other planners on their team. Peace of mind for the client is really what we all seek, right?
Sure.
And planners need to be confident with the referral. And so I truly understand, respect that, and I value and respect the work that the planners do. And I am confident in my ability to work with the client in a way that is not only perceived as a true benefit, but also holds the high standards that they have as a fiduciary, and as well as someone who's always looking out after their best interests.
Listen, I want to thank you for your time today. This has just been a lot of fun, and I really appreciate what you do for planners. You are an unbelievable resource and an unbelievable ally and a partner to the planning community. We're going to get this out to as many people as possible. This is Mark Brownstein. Let me give you his email address. It's mark@emeraldmedicare.com. Did I get that right? Mark at emeraldmedicare.com.
Right.
And his number is 845-358-1220. 845-358-1220. Put this in the show notes. And just folks, listen. This is a resource. This is an unbelievable resource for a very challenging and demanding and timely topic that you've just got to get involved with. And nobody better that I've ever met in my 38 years in the business. So, Mark, thanks again, and we'll talk to you soon.
Okay. Thank you, Frank. Thank you all.